Thank you, Ms. J, for those great instructions. And students, it's time for us to move on to the medicine section. And the medicine section covers the 90,281 to 99,607 series. So medicine section has got a lot of guidelines. It is one of the biggest chapters, and it has lots of guidelines which we need to know. So know the rules. What are they? Let's review some of these guidelines. Let's look into the add-on codes. Some of the listed procedures are commonly carried out in addition to the primary procedures performed, and all the add-on codes found in the CPT book are exempt from the multiple procedure concept. They are exempt from the use of 51, as these procedures are not reported as standalone codes. This means that you cannot append the 59 modifier or the 51 modifier or the 50 modifier with the add-on codes, because they are not reported as standalone codes. Now let's look into the next guideline. Next, it is about the separate procedure. So this is similar to what we followed in the surgery section as well. But let's once again review what the separate procedure guideline is all about. When a procedure or service that is designated as a separate procedure is carried out independently or considered to be unrelated or distinct from the procedure or service provided at that time, it may be reported by itself or in addition to the other procedure or services by appending a 59 to the specific separate procedure code to indicate that the procedure is not considered to be the component of another procedure, but is a distinct independent procedure, which means that if you have a procedure, if we have a CPT code that has been designated as a separate procedure and that is unrelated and distinct from the other procedure, the major procedure, it is not related to that. In that case, we can code the CPT code, which is designated as a separate procedure, by appending 59 modifier to it. So in case if the CPT code that has been designated as a separate procedure is and part of the major procedure, or it is related to the another CPT code or the procedure, then we cannot code that along with it. Now let's move on to the next, which is about unlisted service or procedure. That also is same as the surgery section. It says that if a service or the procedure may be provided that is not listed in edition of the CPT book, you can report such services using appropriate unlisted procedure codes. All you have to do is that you have to produce a separate procedure, special report for that. Sorry, you have to give a special report along with it. Imaging guidance. This guidelines is same as the radiology section. And supplied materials. The supplies and materials over and above those usually included with the procedures rendered are reported separately using the CPT code 99070 or specific supply codes. Now let's move on to the next guideline about the foreign body or implant. So the definition, by definition, an object intentionally placed by a physician or other qualified professional for any purpose that may be either diagnostic or therapeutic is considered to be as an implant. And if an object is unintentionally placed, it is considered to be as a foreign body. So if you have observed any of those operative reports, you might have seen that somewhere it is documented that the surgeon counted the surgical instruments or a scissors or the screws, whatever they have used. They will make a count after the procedure. That is to make sure that nothing is left behind in the patient's body during the surgery. And if an implant that has been moved from its original position or is structurally broken, and that no longer serves its intended purpose or presents as hazard to the patient, it qualifies for a foreign body for the coding purpose. So I guess now you all know what's the difference between a foreign body and an implant. With that, let's move on to the next section. So this is all covered. You can see a lot of section that has been included in the medicine chapter. So as I said, this is one of the law, which is one of the biggest chapter in the CPT book, and it includes a lot of services which are not which are not mentioned in the surgery section because they are non-invasive procedure which is performed. So let's have a quick look into what are those CPT codes or the chapters which are included in the medicine section. We have immune globulin serum or recombinant products, immunization administration for vaccines or toxoids, vaccines, toxoid psychiatry. We have biofeedback. You can see the dialysis, gastroenterology, ophthalmology. We have special otorhinolaryngologic services. We have cardiovascular services which has been performed. That is also included in the musculoskeletal in the medicine chapter. Next, we have non-invasive vascular diagnostic studies, pulmonary studies, allergic and clinical immunology, endocrinology, neurology, and neuromuscular procedures. We also have medical genetics and genetic counseling services, adaptive behavior services, central nervous system assessment or test, cognitive, mental status, speech testing, etc. We have health behavior assessment and intervention, behavioral management services, hydration, therapeutic, prophylactic, diagnostic injections and infusions, and chemotherapy, and other highly complex drugs or highly complex biologic agent administration. We have photodynamic therapy, special dermatological procedures, physical medicine and rehabilitation, medical nutrition therapy, acupuncture, osteopathic manipulative treatment, chiropractic manipulative treatment, education and training for patient self-management, non-face-to-face, non-physician services, special services, procedures and reports, qualifying circumstances for anesthesia, moderate conscious sedation, the other services and procedure, home health procedure services, medication therapy, management services. Yes, that's a lot of topics that has been discussed in the medicine section, and you also have a lot of guidelines related to each of these topics. So my tip for you all is to go and CHUN your medicine section, and that will help you a lot during the exam. So now it's quiz time. And what do you know about immunization? It's time for me to just quickly check what you know about immunization. So are you ready, Chorus? Yes. So this is your first quiz question, and you can put your answers in the chat. Yes, I can see all are in high spirits. Oh, I can see the answers coming up before I read the question. So when coding vaccinations or toxoid, how many codes are required? So coders, quickly you can place your answers in the chat. There you go. The answers are coming, and okay, you can also mention the 2 codes that are required. You can also go ahead and mention. Yes, as you said, there are minimum 2 codes that are required when coding the vaccination or toxoid, and they are: 1, the product code, what is being inserted into the body. Yes, and second is the administration code, that is for a route of administration of that product, such as a percutaneous, intramuscular, subcutaneous, or intradermal. It can be intranasal or oral as well. Great, great, great coding course. I think you all are ready for the medicine section. So I've got next quiz question for you. It's a true or false question. A component is all the things, antigens that make up or comprise one vaccine. Is a statement true or false? Okay, there's a delay in answering this one. Okay, now I can see the answers coming up. Yes, the correct answer is going to be true. A component is all the things that make up a one vaccine. For example, we have measles vaccine. So we have only one component over here. Yes, you are correct. So next, how many components are there in an MMR vaccine? Come on, coders, let me know. Let me know, quickly know. Let me know in the chat. Yes, I told you, you all are ready for the medicine section. Yes, we have three components, and they are measles, mumps, and rubella, and this is a combination vaccine. Exactly. Awesome. Awesome. I can see awesome answers in the chat. And now let's move on to the vaccination and let's review some of the vaccination guidelines. So how to code an immunization and vaccination. So here are your FTRs, your guidelines. A minimum of 2 codes is required as just we have reviewed in the previous slide. One is a product which is sequenced first, and second one is going to be the administration code. And while administering the vaccine for 18-year-old and under with counseling, you have to use the CPT code 90460 family. So keep in mind that code is while administering a vaccine for 18-year-old and under with counseling. That's the most important part. Use the CPT code family 90460. And next, while administering a vaccine for any age group with no counseling, you have to use the CPT code family, which belongs to 90471. So if there is no counseling, and let it be any age, you have to use a family code of 90471. Okay, now let's move on to the next guideline. Code each immunization or component separate by using the family 90460. Next FTR, COVID-19. While coding for the COVID-19 vaccines, you have to remember a few things, or you have to look up for a few things. The type of the vaccine, you have to look for the dosage, whether it's an initial, second, or tertiary, or whether it's a booster dose which has been given. Let's look into the next point. COVID product and admin code should match. This is very important while going for a COVID vaccination. The COVID product and admin code should match. And last one, the code E&M services separately using a modifier 25. So if you have an E&M service which has been provided along with a vaccination, you can append 25 modifier. And finally, we have a coding tip which says keyword is counseling. If no counseling is used, use the CPT code 90471. So with that, I think you all are ready for a coding exercise. Are you ready, coders? Yes, let's do it. Okay, so this is your first coding exercise for the day, and let me start by reading the last portion of the question and the options first. So what are the correct procedure codes for this encounter? Option A, 99381 with 25 modifier, 90702, 90647, 90713, 90460, 90461 times 3. Option B, we have 99381, 90698, 90460, 90461 times 3. Option C, we have 99381 with a 25 modifier, 90702 with 51 modifier, 90647 with 51 modifier, 90713 51 modifier, 90471 with 51 modifier, 90472 times 3 with a 51 modifier. And finally, option D, 99381 with a 25 modifier, 90698, 90471. A mother arrives to the pediatrician's office for the first time with her 2-month-old baby girl. The infant was born at home, and the pediatrician did not have an opportunity to evaluate the infant in the hospital. The physician performed an initial comprehensive preventive medicine examination and administered one injection of diphtheria, tetanus, acellular pertussis vaccine, Haemophilus influenza type B, and inactivated poliovirus vaccine via intramuscular route. What are the correct procedure codes for this encounter? And coders, you've got 2 minutes to solve this one. All the best. And yes, we have Ace AMCI alligator here, and straight away you all are on the top here. Excellent work, coders. So let's start by looking into our inventory. We have a pediatrician's office visit. There is a 2-month old patient, initial comprehensive exam, TTAP, HIB, IPV, virus, IPV vaccine, which has been given. And now let's look into the FTR. So this is your FTR. And from this, I can straight away eliminate few of the answers. This is the FTR which we got from the MCG manual, and let's look into it. 18-year-old and under with counseling use 90460. So my question for you all coders, what's the age of the patient? It's 2-month baby, and is there a counseling which is given to the patient or to the parents? Is there any counseling which has been provided or not? Yes, there is no counseling which was given to the patient or the parents. That means no counseling. You have to use the CPT code in the family 90471, which means straight away I can eliminate all those options which have the CPT administration code of 90460. So option A is having 90460. That's wrong. Option B is also having 90460, which is also wrong. And we have eliminated 2 of the options straight away. So are you following coders? Please let me know in the chat. Yes, exactly. No counseling documented. There you go. 2 options are wrong. And among the option C and option D, the correct answer is going to be option D. I will tell you how. So let's look what option C, D, A, and B is coding for. First, they have coding for 99381, which is an evaluation and management code. So going forward, we will also look into what these codes are. Now, this is a periodic patient's visit code and yearly examination code. So 99381 is for initial comprehensive preventive medicine evaluation and management. And yes, the patient is here for the first time as well. So let's look into the remaining codes. So we have 90698, that is coding for a diphtheria toxoid, diphtheria, tetanus, acellular pertussis, and it is also coding for IPV, which is inactivated poliovirus, and also HIV, which is Haemophilus influenza type B. So this is coding for all the 3 vaccine product which has been given, right? And let's look into the next CPT. We have also 90702, that is only coding for a diphtheria, tetanus toxoid absorbed, that is a TT. So it would be inappropriate to unbundle this DT from that family code, right? This would be inappropriate. That would be unbundling, which means option C is also wrong. We have a family code here. We have a CPT code that codes for all the vaccines which has been given. So we have to use that and not unbundle the components. So which means option A is wrong, option C is wrong, option B we already said it is wrong, and also that is if you carefully look, we have already reviewed that while coding for a vaccine along with the evaluation management, you have to use a 25 modifier with the evaluation management. And option B is double wrong because it is not having that 25 modifier which is appended to the ENM code. So option B is also wrong. And we have a guideline which states that report the vaccine immunization administration code, that is 90460, 90461, 90471 to 90474, in addition to the vaccine or toxoid codes. So we have already got the codes for our product, and now it's time to look for the code, CPT code for the administration. So we have 90460, which is coding for immunization administration through 18 years of age, but that is wrong because it is for with counseling. So we already established that there was no counseling documented. There was no counseling which is given. So 90460 is incorrect. And if you look into CPT code of 90471, that is for immunization administration without counseling. So that is going to be our code selection. And option B is also incorrect. The correct CPT code is going to be 99381, 25 modifier for the evaluation management, and we have 90698, that is for TTAP, IPV, and HIV vaccines. and 90471 for immunization administration without counseling. So how are you all doing, Goddess? How are you feeling after that scenario? Better. Great. Awesome. Okay. So with that, let's move on to the next. What do we have next? So also a general reminder, if a significantly separated identifiable evaluation and management is provided, we have to open a 25 modifier as well. So next we are going to review the COVID-19 vaccines and its guideline. So coding tip or the FTR for you is that remember the product and administration code should match while coding for a COVID-19 vaccinations. So with that said, let me show you a small CHUN version of the CPT book with the COVID-19 vaccine, and you will see how it will help you pick the correct answer quickly and easily. So we have the family from 0001A to 0004A. That's a family, and we have it is coding for mRNA LNP 30 mcg per 0.3 ml diluent reconstituted. So that is the component which is used. We have immunization administration by intramuscular injection of severe acute respiratory syndromes, coronavirus 2, SARS vaccine, mRNA, LNP, spike protein, preservative-free, 30 mcg per 0.3 ml dosage. So diluent reconstituted first code. And while using these family, we have to use the administration code 91300. So 001, 0001A is coding for the first dose of mRNA LNP, 30 mcg per 0.3 ml diluent reconstituted, and 0002A is coding for the second dose. We also have a third dose and the booster dose as well. Now let's look into the next family, 0051A through 0054A. That is for immunization administration of an mRNA LNP 30 mcg per 0.3 ml tris sucrose formulation. And while coding them, the administration code which you have to use is 91305. Let's move on to the next family, that is for 0071A through 0074A, which is for administration of mRNA LNP 10 mcg per 0.2 ml diluent reconstituted tris sucrose formulation. The administration code while using this vaccine, we would give 91307. Once again, we have a first dose, second dose, third dose, and booster dose. Next family is 0151A through 0081A. That is for mRNA LNP 3 mcg per 0.2 ml diluent reconstituted tris sucrose formulation. Admin code is going to be 91308. So you can see the difference in the dosage or the constant which has been used in all these family, and the respective administration code which also has to be coded. So we have few more vaccine codes here. We have 0011A to 0031A. Let's see what it is coding for. It is coding for an administration of mRNA LNP 100 mcg per 0.5 ml. While using this family, we have to give an administration code of 91301. Next, we have a code. We have family 0064A, which is for administration of mRNA LNP 50 mcg per 0.25 ml booster dose, and the administration code which has to be used is 91306. Next, we have 0094A, that is for mRNA LNP 50 mcg for 0.5 ml booster dose. The administration code is 91309. Next, we have 00218 to 0022A. That is for administration of DNA, chimpanzee adenovirus 0.5 ml. Administration code used is 91302. And 00318 to 0034A is for administration of DNA adenovirus type 26 4.5 ml, and administration code to be used is 91303. Finally, we have the CPT code family 0041A to 0042A, that is for a recombinant nanoparticle saponin-based 0.5 mcg per 0.5 ml. The admin code to be used is 91304. So this is a CHUN version of a COVID vaccine coders. And the keyword here is, yes, the keyword that distinguishes the code. And with that said, let's move on. And are you ready for another challenge based on COVID vaccines? Yes, here you go. And you can see how easily we can pick the correct code if you have CHUN that section. And this is your question. Which of the following best describes the encounter? Option A, 0054A, 91305. Option B, 0004A, 91303. Option C, 0074A, 91305, 0034A, 91303. A patient arrives at the clinic for his scheduled booster. An intramuscular injection of 0.5 ml adenovirus type 26 was administered. Which of the following best describes this encounter? You can see some answers coming up straight away in the chat. So still, I will give you 2 minutes for the rest of you to answer this one. So see you all after the 2 minutes. And once again, is AMCI alligator is here. So someone has asked, where can I find these codes in the CPT book. So you can find these codes in the medicine section. So team, if someone can just look into the CPT book and answer that question, that would be great. That will be helpful for the students. So, okay, also someone has said I need to CHUN the section exactly. So I will show you how quickly I pick the answer for this question. So we have patient who has arrived for the booster dose and he had an intramuscular injection of 0.5 ml adenovirus type 26. So let's quickly look into the code option. So you can see I have chunked my section. Yes, I've chunked my entire CPT code section here. So you can see the different type of vaccines that has been used. We have all the first three. This is for an mRNA type vaccine, and the last one 0031A and I think 0034A. That is for a DNA type vaccine. Yes, DNA adenovirus type 26 vaccine. That's based on DNA adenovirus. So let's look into our keywords. We have an intramuscular injection of 0.5 ml adenovirus type 26. So simply by looking to the keywords and matching the code options, you can find that, yes, there you go. The correct one would be 0034A. This is a coding for immunization administration intramuscular of severe acute respiratory syndrome coronavirus 2 vaccine DNA spike protein adenovirus 26 type 26 vector preservative free, and that is for a booster dose, and the patient came for a booster dose as well. So exactly matching the keywords, the correct answer is going to be 0034A, and we also have to give the admin code. That would be 91303. So which help us eliminate option B, A, OA, B, and C straight away. As simple as that. So does the churning help, coders? Do you think the churn helps? Yes, it does. It does the magic, especially during the exam. Okay, coders, so that's time for us to leave the COVID vaccine chapter and let's go for another quiz time. So we have your question here. Option A, once per day. Option B, once per week. Option C, once per month. Option D, once per year. The code range 90951 to 90962 is related to patients ESRD are reported. And you got. I will give you a few seconds to place your answers in the chat. Okay, I can't see any answers come. Okay, there we go. Answers are coming now. It was slow. Okay. And yes, the correct answer is going to be option C, once per month. So they are reported once per month to distinguish the age-specific services related to the patient's ESRD performed in an outpatient setting with the 3 levels of service based on the number of face-to-face visits. So correct answer is C. And next one, moderate conscious sedation codes are not age-driven. Is the statement true or false? Yes, just carefully reading the statement. Moderate conscious sedation codes are not age driven. And the answer is going to be false. Why? let's quickly show you all the FTR on moderate conscious sedation. We have to look at the age, who administered it, as well as the time. So yes, this statement is false. Okay, good. So with that, are you ready for a coding exercise? Are you ready for another coding exercise? Yes, so here is your challenge. Report Dr. McCoy service. Okay, your code options are option A 93015 with the 26 modifier, option B 93015, 93016, 93018, option C 93016, 93018, option D 93042 with 26 modifier. Mr. O'Brien presents to the cardiologist's office complaining of chest pain. Dr. McCoy, the cardiologist decided to obtain a cardiovascular stress test. Because Dr. McCoy's office does not have a proper equipment to perform this test, he sends Mr. O'Brien to the hospital for the test. Dr. McCoy accompanies Mr. O'Brien and supervises the stress test as well as provides his interpretation and written report. Report Dr. McCoy's service. And coders, your time for this challenge is 2 minutes. So I'm sure you're going to slay this one. So see you after 2 minutes. So is the AMCI alligator is back, and I can see, okay, I can see a lot of mixed response in the chat. So let me walk you through this one. Okay, let's start with this. So what we have here, we have a cardiologist office visit. Cardiovascular stress test was ordered. Dr. McCoy accompanies Mr. O'Brien and supervises the stress test, and he also provides the interpretation and the written report as well. So our inventory list, we have a cardiologist office, we have cardiovascular stress test, supervise the stress test, interpretation, and written report. So all this we are having in our inventory. And okay, let's suppose in this scenario, doctor had the cardiovascular stress test machine in his office. Let's assume so. So what would be the CPT code in that case? In that case, the CPT code would be 93015. So let me also take you a quick review through the FTRs for this. So under the cardiology 93015 to 93018, we have the FTRs. 93015 is a comprehensive or global code. 93016 and 93018 are professional components, and 93017 is the technical component. So as I said, in case, suppose or let us assume that the doctor had the stress test equipment with him, and then he does the supervision and interpretation as well, then we append the CPT code 93015, which is a global package. That means it has the professional component as well as the technical component in it. Are we good so far, coders? Let me know in the chat. Are we good so far? Okay, good. Okay, so let us see here. As I said, 93015 includes a tracing. That means the doctor owns the equipment. He does the interpretation and report. He also does the supervision. So that is what 93015 is all about. And if it's a global package CPT code, do we need to append a modifier to it? Do we need to add any professional service modifier or a technical component modifier to it? Would that be correct? There you go. That would be incorrect. We don't need to append any modifier with the CPT code 93015, which is a global package code that includes both the professional service and the technical service as well. So good, great. So let's move on. So in our scenario, the doctor didn't had the stress test equipment with him. So what he did, he took the patient to the hospital which had the equipment, and he accompanied the patient, and over there he performed the stress test. He did the supervision of the test, and he also provided the interpretation. He also did the interpretation, and the written report also was given. Yes, so we cannot append 93015 for this. We have to code for his supervision services. Yes, his professional services, that would be supervision, and the CPT code is going to be 93016, and also for the interpretation and report, and that is going to be 93018. And at the same time, the hospital can code for the technical component because they own the equipment. Yes, and they can claim for the tracing which they done, that is 93017. So hospital will be coding for 93017, that is a technical component, and the physician, the doctor, our doctor would claim for the supervision and the interpretation, and the CPT code would be 93016 and 93018. So are you following, coders? Are we good? Yes. Yes, great. So with that said, let's have a quick look into our code options. So as I said, we had a cardiovascular stress test, which was performed in the hospital. And what the doctor did, he only did the supervision, interpretation, and a written report was given. So these are our code options. Let's look into option D, that is coding for rhythm ECG 1 to 3 leads, interpretation and report only. So as we said, as we saw, the patient did, or the doctor did, a cardiovascular stress test and not the rhythm ECG. So which means option D is incorrect. And let's look into the next code, 93015, option A. So why is it incorrect? Because that uses a 26 modifier. So that's a global package code, and we don't need to append 26 modifier first of all. And second, in our scenario, there was no global service. We are only coding for the professional service. So option A is incorrect, and option B is also incorrect, 930, because it's also having the CPT code 93015. So, and that cannot be coded with 93016 and 93018. That would be unbundling, right? So we cannot code a global package with a professional service again. So option A, B are incorrect, and that leaves with option C, that would be 93016 and 93018. So 93016 is coding for a cardiovascular stress test supervision only, and 93018, that is coding for the interpretation and report. So with that said, option A is incorrect, option B is incorrect, and our answer is going to be 93016 and 93018. So how are you feeling, coders? Did the explanation help? Let us know in the chat. So let me quickly move on to the next scenario. And this is your challenge. What CPT code is reported for moderate sedation? Your options are option A 99152, option B 99152, 99153, option C 99156, option D 99156, 99157. A 5-year-old fell on broken glass and required suturing of laceration. Due to the age and combative behavior of the patient, the provider utilized moderate sedation while repairing the laceration. The provider gave the child 50 milligram of ketamine intramuscular. The nurse monitored the patient during the procedure, which took 30 minutes. What CPT codes are reported for the moderate sedation? And coders, your time starts right now. Okay, great coding coders. So let us quickly go through this scenario. So we have 5-year-old patient. There was laceration, a moderate conscious sedation was given to the patient, and a 50 milligram of ketamine intramuscular was administered. Nurse monitored the patient, and it was given for 30 minutes. With that said, these are our inventory. We have a laceration, moderate sedation, provider administered 50 milligram of ketamine intramuscularly, and nurse monitored, and the time of the procedure was 30 minutes. 30 minutes of moderate sedation was given to the patient. And with that, let's quickly look into our FTR. So for moderate conscious sedation, the CPT codes are from 99151 to 99152 and 99155 to 99157. So what all we have to look? We have to look for the age of the patient. In our scenario, we have a 5-year-old patient. We also have to see whether the same doctor performs the surgery and administer the moderate conscious sedation. In that case, we have to use the CPT code from 99151 to 99152. If a different doctor administered the moderate conscious sedation than the surgeon, then use the CPT codes ranging from 99155 to 99157. And the coding tip for you is watch whether the age is younger than 5 or not. Document next to the code 4 years and younger. And that said, again, let's quickly solve the scenario. So these are all our code options, and let's look into the CPT code 99151, which is coding for a moderate conscious sedation by the same physician or the other qualified healthcare professional performing the diagnostic or therapeutic service. That's sedation supports, requiring the presence of an independent trained observer to assist in the monitoring of the patient level of consciousness and physiological status. Initial 15 minutes of intra-service time. The patient age should be younger than 5 years of age. So let's cross-check our age of the patient in our scenario. We have a 5-year-old patient. So 99151 is a wrong answer because it is coding for a patient who is younger than 5. And our scenario, patient is 5-year-old. And also in our scenario, it's the same surgeon or the same physician who is administering the moderate conscious sedation, and the same physician or the surgeon is doing the laceration repair as well. So the code family is correct, but the CPT code is wrong. So let's look at 99152, which is for moderate sedation by the same physician or qualified healthcare professional. Initial 15 minutes of intra-service time, patient age 5 years or older. So that is also a good code, but that is incorrect because it's only coding for 15 minutes, right? It is also for the patient age who is 5 years or older. That's correct. That part is correct, but it is only for the 15 minutes. It's only coding for initial 15 minutes. And if you look into the scenario, we have a 30 minutes of moderate conscious sedation that is given. So we also have to give an additional code, that is an add-on code, in order to correctly match the time for which the moderate conscious sedation is given. So let's look into option B, that is for 99152. Yes, that was a good code, and it requires a 50 more minutes, right? So we have to add 99153 along with it. That is for each additional 15 minutes of intra-service time. So that will sum up to 30 minutes. And yes, that will sum up total 30 minutes, which is the time that is given in our scenario. And this is our correct answer. So let's look into the other options as well. Let's look what option C and option D is coding for. So option C and D is incorrect because that is coding for a moderate sedation services provided by a physician or other qualified healthcare professional other than the physician or qualified healthcare professional performing the diagnostic or therapeutic service that the sedation supports. Yes, so 99156, 99155, and 99156 and 99157, that is coding for when a moderate conscious sedation is administered by a provider other than the surgeon. So in our scenario, the same provider who performed the surgery or the laceration repair given moderate conscious sedation. So that is totally different family. With that said, option C and option D is incorrect. Both are not coding for the same provider. And the correct answer for the scenario is going to be option B. So how are you feeling, coders? Let me know in the chat. Okay, good, feeling great. Okay, good to know. And also we can solve this using the chat. Yes, I see someone already mentioned that in the chat that we can solve this one using the chart as well. So if you look into the moderate conscious sedation chart, you can see 99152 and 99153 is coding for when the patient age is 5 years or older, and that's for the time between 23 to 37 minutes. We had a 30 minutes of moderate conscious sedation given. Yes, so next to that will be for age less than 4. And the correct code is, as we said, 99152 and 99153. So that's another way you can select the correct code for moderate conscious sedation. So I hope everyone are feeling good about that scenario. So quickly, let me move to the next scenario. I think that's the last scenario which I've got from this section for you all. Okay. And your options are option A 90960, option B 90966, option C 90970, option D 90970 times 11. A 45-year-old patient with end-stage renal disease has no home dialysis, has in-home dialysis services initiated on the 15th of the month. The physician provides dialysis every day. On the 19th, the patient was admitted to the hospital and discharged on the 24th. The physician and the patient began in-home dialysis again on the 25th and continued every day until 31st. So what are the CPT codes which could happen for this dialysis services provider? Once again, coder, you got 2 minutes to code this one, and we'll quickly see after that. And coders, you all are absolutely amazing today. Yes. So what are we having here? We have a 45-year-old patient with an end-stage renal disease, home dialysis services initiated on the 15th of the month, dialysis every day. On the 19th, patient was admitted to the hospital and discharged on 24th and began in-home dialysis again on the 25th and continue every day until 31st. And these are our inventory. We have end-stage renal disease, home dialysis, 15th of the month to 18th. That means we have got 4 days of dialysis which is provided, right? So we have 15th, 16th, 17th, and 18th. That means we have got 4 days of dialysis provided between 15th to 18th. Now this is a daily dialysis which is given by the physician. And then from 19th, patient was admitted to the hospital and discharged on the 24th. So a dialysis was not performed between 19th to 24th. Then the dialysis resumes on 25th to 31st. So 25th, 26th, 27th, 28th, 29th, 30th, and on the 31st. That means we have got Once again, 7 days of dialysis. Yes, till the end of the month. That's 31st. We have got 7 days of dialysis as well. So you got a chance to change your codes as well now, coders. Okay. So let's quickly review the guidelines for end-stage renal disease service. Monthly CPT codes is ranging between 90951 to 90970. You have to look for the location of the patient, whether it's an inpatient dialysis or outpatient dialysis or a home dialysis service provided. In our case, it's a home dialysis services that's performed. Next, look at the age of the patient. We are having a 45-year-old patient. And last, whether a complete assessment is performed or not. And the coding tip is monthly services are coded for the doctor services other than the dialysis administration. This represents doctor's work for an entire month. And if the patient services, the doctor must use individual codes per day. The only exception to this rule is if a complete patient assessment was performed by the doctor for the month. So with that in mind, let's look into the code options which we have. And these are all our code options. So let's begin by looking at the keywords. We have a home dialysis service which is performed, right? And the CPT code 90966 is coding for end-stage renal disease related services for home dialysis per full month. And also the CPT code option A 90960, which is for end-stage renal disease related service monthly. Yes, that's for a patient for 20 years of age or older with 4 or more face-to-face visit by the physician or other qualified healthcare professional per month. So did we have a 4 or more face-to-face visit by the physician here? I don't think so. That's also for a monthly dialysis services. And 90966 is also for a dialysis services that is provided for a full month. We didn't have a full month dialysis services in our scenario. That was break in middle. So option A and option B is incorrect because of that. And now let's look into option C. That is 90970, which is coding for, okay, that is, here's your code option, that is coding for end-stage renal disease related services for dialysis less than a full month of service. Yes, so we didn't have a full month service provided here. Per day for patients, yes, per day for patients 20 years of age or older. That's what 90970 coding for. And the age of patient is 45 in our case. So that's why we picked 90970. But still option C is wrong. You know why, coders? You know why? Yes. Yes, these are per day codes. And how many days of dialysis was provided in our case? These are per day codes. Is that 12 or is that 11? If you remember what I explained in the beginning. Yes, so option C is wrong. That is for just 1 day. But in our scenario, exactly, the services was from 15th till 18th. That means there is a 7-day, and from 25th to 31st as well. That means, I'm sorry, 15th to 18th, that's 4 days, and from 25th to 31st, that is 7 days. So 4 plus 7, it's going to be 11, and we have to append, yes, times 11 with the CPT code 90970 because there is 11-day dialysis services that was provided. Fantastic, coders, you all are nailing these medicine section. Amazing. I'm so proud of you all. So the correct answer is going to be option D, and you all did a great job on those scenarios. So don't forget to leave a feedback or survey. Why the feedback is important? It helps AMCI to deliver quality classes. It helps your instructor to help you and no